man laces up sneakers, grabs a water bottle, and gently stretches. Hi, I'm Dr. Behnaz, certified pelvic floor specialist. You've heard me talk about urinary incontinence, pelvic floor muscles, and how therapy can help. But now let's talk about something just as powerful, your everyday habits. Because healing doesn't just happen in the clinic, it happens in how you breathe, sit, stand, lift, and even go to the bathroom. This final video in our series is all about what you can do daily, starting today, to protect your pelvic floor, support your bladder, and live leak-free with confidence. Why habits matter. The pelvic floor is always working, even when you're not thinking about it. Whether you're coughing, laughing, walking, or lifting groceries, those deep muscles are coordinating with your core, breath, and posture to hold everything in place. But modern life, like long sitting hours, poor toilet posture, breath holding, or high stress can weaken or overwhelm the system. That's why today we're focusing on bladder-friendly behaviors and body mechanics that support your continence every day. First habit, breath right to engage your core. Many of us unknowingly hold our breath during daily tasks, especially when lifting, getting out of a car, or bending down. This increases intra belly pressure, which pushes down on the pelvic floor and bladder. Instead, I want you to practice breath out with effort. Blow out as you lift a bag. Exhale slowly when standing up. Breathe deeply into your ribs, not just your belly or chest. This engages your diaphragm and pelvic floor together just like a team. Next habit that I want you to work on is your toilet posture. How you sit on the toilet affects how completely and easily you empty. Here's what we teach in pelvic floor therapy. We ask you to sit fully on the seat. Don't hover. Use a squatty potty or footstool to bring knees slightly higher than your hips. Lean forward with a straight spine. Relax your belly and don't push or strain. Avoid forcing urination or rushing. This prevents incomplete emptying and protects your pelvic tissues from unnecessary pressure. The next habit, I want you to hydrate smartly. Many people with bladder leaks start drinking less water, which sounds logical but actually backfires. Dehydration causes concentrated urine, which irritates the bladder lining. Smaller bladder capacity, more urgency, and nighttime trips. So here's the rule. Drink small amounts often rather than chugging all at once. Aim for 6 to 8 cups of water daily. More fluid intake if you're active, breastfeeding, or in hot weather. Reduce fluids slightly after 7 to 8 p.m. to help with nighttime leaks. Avoid overdoing caffeine, citrus, carbonated drinks, or alcohol. These can be bladder irritants, especially in sensitive individuals. The most important habit I want you to include gentle pelvic floor exercise daily. You don't need a gym, you just need consistency. Pelvic floor training is most effective when it's done regularly, 5 to 10 minutes per day. Coordinated with breathing, practiced in different positions, lying, sitting, standing. I want you to focus on slow holds. Contract and lift gently for 5 to 10 seconds. Quick flicks, 1 second contractions for sudden support. Relaxation, learn to fully let go between reps. And remember, this isn't just about the squeezing. It's about awareness, timing, and control. Next habit is to move often. Sit less. Prolonged sitting weakens glutes, stiffens the hips, and reduces pelvic floor blood flow. Break up sitting every 30 to 60 minutes with a few standing stretches, gentle pelvic tilts or bridges, a short walk or stir break. This improves blood flow, encourages bladder emptying rhythm and supports pelvic tone. The next habit, lift smart, not hard. Many leaks happen during daily lifting, groceries, kids, laundry baskets. Here's how to protect your bladder. Exhale before and during lifting. Pre-engage your pelvic floor gently, like picking up a blueberry. Bend your hips and knees, not your back. Avoid breath holding or straining. With practice, these protective techniques become automatic. Let me bring you a real life story. One of my clients, a 38-year-old mother of two, had my legs when lifting her toddler and jogging. Her pelvic floor strength was decent, but her daily strategies were working against her. We didn't just prescribe exercises for her, trained her to breathe and move better, adjusted her lifting mechanics, changed her bathroom habits, taught her to relax, not just contract. After 6 weeks, she was dry, running again, and saying, I feel like I have my body back. And key takeaways for you. Your bladder health depends on daily body mechanics and habits. Breathe with intention, sit with support, lift with control. Stay hydrated but smartly. Train your pelvic floor with both strength and softness. Smart changes practiced consistently create real transformation. And final thoughts. This concludes our 7-part series on urinary incontinence, from stress leaks and urgency to menopause and prolapse. I hope you found clarity and confidence. If you've been struggling silently, please know this is common, not normal. You're not broken, and help is available. I'm Dr. Behnaz, certified pelvic floor specialist, and I believe every woman deserves to feel in control, supported, and strong. If this series helps you, please share it with someone who needs it. And remember, you are not alone. Thanks so much for joining me. I'm thrilled to support your pelvic health journey. If this video brought you clarity or encouragement, just tap subscribe, give it a like, and ring the bell so you'll never miss a moment of guidance.